Hey, Bethany.
Good morning, or good afternoon, I guess.
A few minutes. Good afternoon, Tom.
Hi.
Well, I'm glad. I didn't know. I just realized that the calendar invite for this came to me, and I didn't know if it went to you. So I'm glad that you have it. I forwarded it to you when I was signing on, just in case.
Yeah, I've got the presentation ready.
Great.
Hello.
How are you?
Good. Hi, Dr. East. I'm Deborah Breitfeld. I'm the Executive Director of the New Mexico Technology Council.
Oh, great. Nice to meet you.
Nice to meet you too. Hi, Terry. Thank you so much for helping us coordinate this today.
Oh, no problem. My pleasure. How are you doing today?
Good, thank you. How about you? Are you here in Albuquerque?
Yes, I am.
Excellent.
I'm 2 doors down from Tom right now.
Oh, really?
Yes.
That's
So,
awesome. So Tom, you're in Albuquerque too then?
Yep. Our office is not far from the airport.
Perfect. I was wondering where your office was. If it was the old, it wasn't the old Ethicon. You're in another office building there?
yeah, we're on the corner of Yale and Gibson.
Perfect.
Right, really on the way to the airport. One of the parking rides.
Yeah, okay, yeah, I was gonna say, or by the old, okay, not by the parking rights,
We're
by the old Presbyterian, but.
Yeah, we're
Yes, we are near the old Presbyterian PAC building.
Yeah.
And I was trying to remember years before that, what that, who was in that facility? But it's not coming to me. And so, Dr. East, will you be sharing your screen?
Yeah.
Okay.
I will. Got my slides ready to go.
Great.
we go ahead and try it? Let me make sure I've got everything.
Yeah, that'd be great.
So have you got the full screen version?
I do. It looks great.
Okay, good. Just making sure. All right.
So we've got a few more minutes before the session starts. So
How's the meeting been going?
it's been going really well, really well.
Great.
And we haven't had, well, I'm not going to say that until after the session, until 1 o'clock, when I can say that, the things that one shouldn't say. So we've done a great job, a small staff, and we've been able to pull it off. Thank you for your sponsorship as well, supporting the session. Had a really great speaker this morning on artificial intelligence, and then he called it, disruptive innovation.
Nice.
So sometimes how you come across innovations and solutions that you really didn't start with at the beginning.
Right.
So all of those are in our socio platform, or will be, should you get a chance to go back and take a look, have any interest in any of the other sessions as well.
Cool.
This is usually an event that we have about 400 people in person. And so that's the real beauty of it, is being able to provide just, some great networking sessions.
Yeah.
So we've been able to provide some really good content. And so we'll continue to try to be creative in our future programming, even just to set up different kind of interactive Zoom sessions and just things for people to interact, because that's kind of the beauty of our conferences. Folks who don't typically get out of the office and go talk to their peers, gives them the opportunity to do that.
Sure. So there's 45 minutes total. So we probably want to wrap up and leave time for questions at the end, I assume, right?
Yeah, that'd be great. Well, if you'd like, okay, I guess we can wait a few more minutes unless you'd like to get started.
It's up to you guys, whatever the schedule is, I'm happy to.
Yeah. Okay, well, why don't I start and just read a little bit about you, Dr. East. But I do find it interesting that I always find it a little more interesting to hear from the individual themselves than somebody reading your bio. But Dr. Thomas East is the CEO for SYNCRONYS, formerly known as Loveless Clinic Foundation, doing business as New Mexico Health Information Collaborative, which is the New Mexico State Designated Health Information Exchange. So we'll look forward to hearing from you. It sounds really interesting. Over the last 6 years, Dr. East has led the NMIHE, HIE, a lot of acronyms being thrown around through this conference, their expansion and growth towards a new innovative healthcare interoperability program sponsored by CMS and New Mexico Human Services. He has over 20 years of experience in healthcare executive information technology leadership. Also has 13 years of experience with academics and innovative research and new product development. So please help me welcome Dr. East.
Thank you. I appreciate the opportunity to talk to everyone today. Can everyone hear me okay and see the slides? I guess I'm not sure how you'd let us know, but maybe in the chat if you need any help. Oh, good.
We can see your slides.
Great. Okay. So I'm here today to talk to you about SYNCRONYS. We basically have rebranded what used to be called the Loveless Clinic Foundation, and we did business as the New Mexico Health Information Collaborative. But we've recently rebranded as SYNCRONYS, and we have operated the state's designated health information exchange for a number of years. Let's see. So our vision is perfectly informed healthcare for New Mexico, making sure the information that people need is available when and where the patient needs it. This is just an overview of our services. In the center is our stack of services, the core of which is an integration engine that talks lots of different standards. It can do HL7, it can do integrating the healthcare enterprise, XDS, XDR, CCDs and CCDA exchanges, and we do support FHIR as well. As well as other non-standard data exchange techniques. And that's used to connect all these different players from delivery systems, hospitals, ERs, diagnostic services, long-term care, ancillary care, to each other. And we also are connected with the payers, with the Medicaid managed care organizations, and they share a roster with us monthly. So there's always the latest Medicaid participation information in the HIE. And we also work with True Health and Anthem and United Healthcare, our other payers we participate in. We've worked for a long time with Department of Health. We do the public health reporting for the state and the syndromic surveillance. So for example, all of the recent COVID-19 reporting, we've been scrambling to get all the different laboratory sources of COVID-19 testing integrated and delivered to Department of Health. We've really stepped up the frequency of reporting so that they have good data in a reasonably timely manner. We also have worked with Social Security Administration, Indian Health Service, and we're connected to other HIEs in other parts of the country, as well as the DoD and VA. This slide's hard to read the detail, but this on the left, it shows organizations that are participating. You can see we have organizations throughout the state. And this image on the right-hand side shows where the patients are from, and the size of the bubbles is the number of encounters. So you can see we have patients from throughout New Mexico, as well as southern Colorado and western Texas and even Mexico. So what was the prior state before we started on this interoperability program? I mentioned we've been providing HIE services for a number of years and have been live on this Orion Health platform since 2015. We receive information from a majority of hospitals, ERs, long-term care facilities, labs, imaging service providers, some practice groups. So you have to ask the question, what has kept the HIE from having a more compelling value proposition in the market? The main things we've heard, and we've had a number of different consultants go out and help us gather information and feedback. A number of organizations do not share a standard clinical data set. The end result is there's holes in the longitudinal clinical record where there's missing information because some organizations don't share at all and some don't share a very comprehensive data set. So why does that happen? I think cost issues to connect their EHRs to the HIE, concerns over data sharing and risk of data sharing, and unclear value proposition. What's in it for me to share information with the HIE? Second major area is not all organizations use the data in the HIE. So some places may share data, but they don't actually use it. And the biggest concern there is what we already mentioned, holes in the longitudinal record. So they may say, well, it's great, it's got all my data from Loveless, for example, but I'm looking for information from another organization and I don't see much here. Important referral organizations are not in the HIE, so if they are working with a particular hospital and that hospital doesn't participate, there's not much incentive for them to use the HIE. And the other aspect that's challenging are referrals or transport across the New Mexico borders. So if they send someone to Texas, they would like to be able to see information from that hospitalization or acute care episode. The information available from the HIE is not seamlessly integrated into the EHR workflow. And that's frustrating for people. No one wants any more extra clicks than they have to. And there's an unclear value proposition in terms of what am I going to get out of it if the data I need isn't there, or even if the data is there, what's in it for me to participate in the HIE? There have been issues around consent for access to New Mexico's sensitive health condition data. And we have evolved a fractured health information interoperability landscape in New Mexico. So there's competitive interoperability services from service providers like Collective, who do the emergency department information exchange. Roads, it's an analytics group that is part of Tricor. They do analytics on various diseases and provide services for payers and so on. So this is kind of the prior state, and with great help from Human Services Department and Department of Health, we've put together a health information interoperability program that is now funded with federal matching dollars from CMS. And it's a collaborative effort to bring the strengths of several organizations together to support the health of New Mexicans in providing a seamless, integrated interoperability solution for New Mexico. So we have partners at Collective Medical, of course, CMS and HSD, eHealth Technologies that provides image sharing. Our big population health platform is Orion Health. HBI Solutions is going to provide analytics. We work closely with Department of Health and the Roads Group for the analytics that they do And so I'm going to go through today and talk to you about what the goals are of this interoperability program. It is going to be in operation through September 30th of 2021. So it's not a very long time period. It's an aggressive schedule, and we're anxiously recruiting folks to participate in our program. So the number one goal of this program is to exchange a standardized data set between all participants in a patient-centric model of healthcare and wellness. And our recommendation is to adopt what Office of the National Coordinator and CMS has deemed essential. That's the US Core Data for Interoperability standard. The other aspect of this that we heard loudly is information must be effectively integrated into workflow. The priorities for implementation being completing hospitals and health systems, adding exchange with neighboring states, regions, and nationally, adding prisons and detention centers, completing all FQHCs, adding behavioral health, Department of Health, public health clinics and hospitals, specialty practices, long-term care, hospice, and home care. So we have a big challenge ahead of us to get all of these folks on board and exchanging information. The goals are to get 80% of most of the organizations and 40% of independent physicians and behavioral health by the end of this program. And the idea being to exchange this US core data for interoperability data set. In the past, we've exchanged a data set that looks like this, and not all participants share the same amount of information, but it's a fairly small data set that's really modeled after a transitions of care record. In other words, it's the information that folks felt were important to hand off to another provider who is going to be seeing that patient. The goal is this, oh, sorry, I shouldn't touch my mouse. The goal is adopting this US CDI, and I know it's hard to read here, but it's a much richer data set with a lot more detail. For instance, it includes a lot of the vital signs, including measures for neonates and pediatrics patients, lots of different kinds of reports, and so on. And folks may say, well, this is a big challenge. Well, the ONC and CMS rules say that, now they just updated them the other day, but by 2022, the certified EHRs are supposed to support sharing this US CDI. So it's coming, and we'll do our best to work with people. Some vendors are a lot closer to it today than others, but we'll get as close as we can to this required data set. In terms of workflow integration, we can deliver data in a wide variety of methods designed to fit the needs of the customer. So we can provide a clinical portal that's a web-based product of integrated data with an easy to navigate user interface. And it's much nicer than digging through PDFs or what are called coordination of care or consolidated clinical document architecture documents. We can do a send to my EMR functionality where if you're looking in the HIE and you see something of interest, you can click a button and it will save that to your EMR. We are compatible with enterprise single sign-on like Imprivata. We also are compliant with SAML to give a full seamless integration into an application. And we support query and retrieve functionality if someone wants to reach in and pull out documents like CCDs or CCDAs. We support APIs that pull data from us. We also support FHIR APIs. There's a business intelligence SQL query interface. We can push CCDs, CCDAs, HL7, PDF, Excels, and so on to a customer in a variety of different ways, secure FTP or other things if they're interested in receiving data in a push format. We can do real-time push HL7 event notifications. The events are things like admissions and discharges and transfers. And we offer direct secure messaging with attachments like CCDs or CCDAs in any other document. The direct secure messaging, if you're not familiar, is a secure encrypted email that is connected, and the security and standards are managed by Direct Secure Trust. And ONC and CMS have deemed that as a approved method for exchanging information for healthcare. So now in this program, funding is available to help pay for the EHR side of the interfaces that folks were concerned about previously, not being able to have the funds for, and workflow integration. But I'd encourage you to contact us as soon as possible if you're interested. Funding is limited and only available through the end of September next year. So if you're interested, we do have funding available to help overcome that financial obstacle. We participate in various regional and national exchanges. We are a member of the eHealth Exchange and the eHealth Exchange Hub that are also projects under the Sequoia project. But they currently connect together 61 other state and regional HIEs, 3 federal agencies. It includes DOD and VA and the various other Social Security Administration and so on. 75% of hospitals, 70,000 medical groups, 5,000 dialysis centers, 8,000 pharmacies, and 120 million patients. So you can access that hub through us. And the hub is a relatively new model, and it's very nice because you basically only have to certify one connection to the hub, then you can reach anyone connected to the hub. So we are now a certified member of the hub. We're connected to the Utah Health Information Network. We're connected to the new Joint Health Information Exchange for DOD and VA. We're working with Colorado and El Paso to get connected. A lot of that work in certifying folks on the hub ground to a screeching halt with COVID-19. We're hoping to resume that soon. People already are accessing us through the hub, like DOD and VA. We've seen an explosion of queries and information requests. We've, as of the end of June in 2020, we had seen 4,700 patient records accessed since January. So people are actively querying us for records on patients from New Mexico. To give you a flavor of what kind of information you might expect to find from the VA and DOD, they give a very rich set of data, including CCDAs with all the usual pieces of information in them, and a variety of notes of different types. And the beauty of it is, if you're in active duty, they are required to participate in the exchange. So everyone who's in active duty military, their records will be accessible. Retirees and VA participants are opted in automatically, but they can choose to opt out. But there's a very rich set of data available. We're We're also a part of the Strategic Health Information Exchange Collaborative, which is a collection of health information exchanges across the country. And they have an initiative called the Patient-Centered Data Home. And we're certified and ready to go in the Western region and the national exchange. And they have done a lot of notifications, billions of notifications, 177 million event notifications exchanged recently, and they have about 45 HIEs that participate in that. So if we go back to some of our requirements from number one, we needed to improve the connectivity and the availability for folks to connect to us. We've addressed that. We're also working closely on these regional and national connections. And we offer the workflow integration. So the second goal is to improve the quality, performance, business continuity, and security and privacy of the HIE to help offset some of those concerns about the risks for sharing data with us. We want to explore legal and regulatory issues around the New Mexico sensitive condition laws and how we may deal with them with the least impact on providers. And we have engaged an attorney and a couple different consultants who understand these issues from other states and how they've addressed them, as well as some a lobbyist to help us if we need to make changes to legislation. So that's moving forward. We're implementing a medication fill data and community med reconciliation platform so that there'd be one place you could go to find a person's medications and reconcile them. We're adding sharing of images, and I'll show you a little more about that. So new value-added functionality, we're moving to Orion's Amadeus platform. This is their platform for pop health and precision medicine. The big steps up for us is this is all in AWS. It gives us improved scalability and disaster recovery. It is a high trust certified environment, both the applications and the AWS platform. So in terms of security, it's a significant improvement in security. And this platform includes both SQL and non-SQL databases for a variety of different purposes. The green check marks I added in here to show these have already been brought live. So throughout this, you'll see some green check marks. Those are the pieces that are already up and running. We're going to be adding a coordinate module that empowers cross-community collaboration and care. And the medicines module, which is an integrated medicines platform for complete patient-centric view of medicines. And those two modules will be added. We're going to be working with eHealth technologies for image sharing. Their image exchange is tightly integrated with the health information exchange, and they allow you, here's an example, if you're looking at a chest CT result, there's a little link that says view image. If you click that, up pops a DICOM diagnostic quality image viewer, and the image is available to you. There's also the capability to do consults. So you can do a collaborative session with other caregivers in the community where you both are looking at the same images. There's also the ability to transfer an image you're interested in to your local PACS system. So the next set of deliverables are expanding notifications to include notifications on result values, risk scores, to help identify and notify providers of patients with drug-resistant organisms, risks such as risks of communicable diseases, risks of ED admission, readmission, self-harm, opioid abuse, and overdose. Notifications will be integrated into clinical workflow. We are going to implement the infrastructure necessary to gather, store, and share social determinants of health. We're putting in place flexible analytics products for quality indicators, gaps in care dashboards, custom analytics, as well as predictive analytics for managing risk at a population and an individual level. We're adding a statewide advanced directives registry that will allow folks to access the most forms, medical orders for scope of treatment forms, as well as other advanced directives. So this is just to give you a sense of analytics. We're going to be working with HBI Analytics. It will be tightly integrated with the Health Information Exchange in their Spotlight Analytics platform. So here's an example of the Spotlight system helps healthcare organizations target patients at risk to prevent unnecessary cost, utilization, disease, and death. So for any group, you can look at cost risk, utilization risk, chronic diseases, development risk, disease exacerbation risk, and mortality risk. And the goal is to help individuals then. So this is an example of a dashboard at the population level where you can see the predicted risks for cost and admissions and ER visits and mortality, ED visits in the future, and so on. Then you can drill down to an individual and see their particular risk factors as well. And let's see here. Let's go to the next slide. So it includes risk models developed by Stanford, and they spun those out into this company, but they've been verified and validated and published in the literature. Things like costs, ER and inpatient admissions, risks of acute myocardial infarction, asthma, fractures for the elderly, sepsis, stroke, opioid overdose, suicide attempt, as well as chronic conditions like coronary artery disease, congestive heart failure, type 2 diabetes, opioid abuse, heart valve disorders, and so on. And as I mentioned, we're adding a module that is about sharing advanced directives and the most forms. We're going to be working with a company called Vinca, and they work with healthcare organizations, and then they're going to aggregate these forms and make them available through the HIE for customers. In addition to these value-added functionality pieces, we're working with our partners on targeted high-value use cases. So kind of narrowly focused, but specifically focused on major challenges we're facing in New Mexico and how we can help. So one of them is on substance use disorder, transitions of care management, ED optimization with decision support, mental health care coordination, and hepatitis C care coordination. Collective Medical is focused on 4 high-value use cases. The substance use disorder management piece, they've already completed that use case and are starting to work with clinicians to implement it. So it's got a green check by it. Mental health management in terms of the transitions of care between acute and long-term and behavioral health management. Transitions of care management in general between hospitals and physicians and EMS and home health and so on. And then they're going to be optimizing there and adding to their ED product to provide decision support that will increase their ability to help with decision makings in the emergency department. The Rhodes Group is working on a hepatitis C management module. This will not only help in terms of recommending the types of tests they should receive, but also based on the results, help with choosing particular treatments. They're providing that information now for care coordinators in the different payer groups. So at the beginning, I mentioned challenges. And in this program, I think I've discussed ways that we're addressing the cost issues, the concerns over data sharing and risks, the adding a lot of value to help make it clear why it's worth it to participate. We're going to be closing holes in the longitudinal record. We've added, we're going to be getting all the different providers in New Mexico, but also organizations across our borders. We have workflow integration solutions that are available, and we've added the 5 high-value use cases and a number of value-added functionalities like image sharing. So we think that we have significantly improved the value proposition, and we're working on the issues around consent. And we've brought together all the different people who were providing different and sometimes competitive products under one tent. And the intent is to provide a seamless integrated solution where folks can go to one place and find all these things instead of several different places. So I wanted to thank you and encourage you to reach out to us if you have more questions. And I'll open it up for questions at that point.
Questions and comments, feel free to unmute yourself and join in the discussion or have some comments, some questions. So that is just a lot of data that you tackle, Dr. East. I'm very impressed.
Yeah, it's a big challenge, but we think we can make a significant impact on it.
And have you seen a big change with the pandemic? Have your all lives changed? Well, I mean, everybody's lives have changed. I guess just mean operationally and that kind of thing.
Oh yes, we've been scrambling to work with Department of Health to connect a lot of different places where folks are getting COVID-19 testing done. So we've had to add a lot of interfaces and integration work in order to support the state's response to COVID-19. We've also been working with places like the homeless shelters, where the providers there need to know COVID results in order to effectively choose where to house people. And so we've given them access to not only the HIE, but other COVID results to help them take care of these folks in the homeless shelters. So we've been doing a number of different things to help respond to the COVID-19 crisis.
So Tom, this is Terry Stewart of the Chief Administrative Officer at Synchronys, and there is a question in the chat box from Andrew Padilla, and he's wondering how ONC's new rules regarding opening health records to patients' health HIEs, if any, as a third-party consumer of provider data.
Well, we, of course, will be complying with any of the data blocking rules and making information available as requested and required under the new rules. A lot of the focus of these rules is on providing information for patients. And at the present time, we don't have a patient-facing portal. We have the capability of doing that, but up until now, we haven't been doing it because we got some feedback from folks that they already have portals to their own various providers and organizations and didn't need yet another portal. But we can certainly provide that if there is a need and an interest in providing more opportunity for patients to access their own medical records. Does that answer it, or do you have other questions? I think the other aspect is that data blocking rules in general are a good thing for us because it hopefully will help overcome some of the barriers that have been out there that prevent data sharing. So the data blocking rules should help overcome some of that.
And how does it work on a national level? I'm sorry if I missed that, but I think you said you do interact with a number of the national organizations as well.
Mm-hmm. We participate in the eHealth Exchange, which is one of the largest national health information exchange platforms. And we also participate in the Chic patient-centered data home platform. And we're all watching closely TEFCA and the evolution of these future models for healthcare interoperability in the country. Where in the future they will have a QN and they will be connecting QNs together into a large network of networks across the country. And we will be participating in that as well as those become, the rules and the plans become clearer.
Terrific, thank you.
Sure.
Any other questions or comments? For Dr. East? Yeah, because how do you think, as far as progress has been made, it's as the end consumer, it's always kind of an interesting spot to be in, where you're, by chance, if you're going outside of a system to see a specialist, sometimes it can often be a challenge to get your records transferred. It seems like in certain cases it works out smoothly. Do you think there's been progress made, and that's really probably part of your role as well?
Yeah, that's definitely what we hope to improve. If folks are all participating and using the HIE, then you should be able to go to whatever provider you want, and they can access your record with your permission to see your records, so that you wouldn't have to worry about getting records transferred or folks being unable to see your records from other organizations. So we sincerely hope we'll be able to help remove some of those barriers over time. And I know Terry, and another part of our major improvements here, she's leading a team of customer relationship managers, and they are doing outreach and connecting with providers across the state to work with them to find out how the HIE can effectively help them and support them in their clinical work. Terry, did you want to add anything to that?
No, yes, I mean, we have individuals who have certain segments of the market. So we have an individual who's covering hospitals, as well as Indian Health Service and tribal health clinics, nursing, skilled nursing facilities, long-term care, physician practices, even correction facilities and detention facilities. So it's a broad group of stakeholders who could use our health information exchange and be able to access and share information on patients. So you could go to our website and you would be able to obtain by the segment of the market you're looking for who would be the contact, the correct customer relationship manager for you to contact for more information. Or you could send an email to info@synchronys.org, and that would be directed to the appropriate staff member.
Terrific. Well, thank you. I did have an experience recently where, and I think everybody has their own stories, but thank you very much for your work on this. As I mentioned, before, gosh forbid if you were with one provider or one healthcare entity for so long, and then you ended up at UNMH and, trying to get any of that information. In the old days, it seems like it used to be much harder. And recently I had an experience where I got a call from a provider. They said, according to New Mexico Health Connections, you need to have this procedure done. Would you like to schedule that appointment right now? And I said, yes, that would be great. Then I kind of still then went, I'm sure that's all part of the proper healthcare sharing of information. And it was very handy for me. And then completely as an outside care provider, they said, I said, but I'd really like the doctor to be able to see my previous records and results. And they said, oh yeah, absolutely. When you come in, we can have full access to your records. So felt like a little bit of a small miracle. So thank you for playing a role in that.
You're welcome. And that's what we're trying to do, is to allow, it's very helpful for the specialists. And that's, the part of healthcare where I have worked previously, to be able to access and obtain the records from primary care. And as Dr. East mentioned, we're going to have images, not only the X-ray reports, and that's really helpful with many specialists who now make copies of, CTs and have to put them on discs, and patients have to pick them up and bring them to appointment. Now those actual images will be in our portal, and we, the patients, no longer have to transfer CDs from one physician practice to another. So, hopefully all of this is a benefit for the providers, but for all of us as patients as well.
And so if someone tells us that we need to, because then also a recent experience was, you need to come over here to get your daughter's CD of the results. It's just like, really? Can I please give you info at SYNCRONYS?
Yeah.
So, right, they have to be signed up for that. They have to be willing to give us their images. So, that's where you as patients can help encourage your providers and share the message of how this would be beneficial for you if they were part of our, clinical portal.
Terrific. Well, any other questions or comments? We got a couple of thank yous. I would want to thank you both very much for your great presentation, really important information. And we'll look forward to learning more, getting to know you more, and however we can support you in any efforts that might be of assistance. We also have, we have job board. We also have a public policy committee. So should you do any work related to the legislative session where we can be of help, keep us in mind, and thank you for your support.
Our pleasure.
Yes, thank you for inviting us. And Deborah, are you the contact if we wanted to post something on the job board? Because we do have some positions.
Oh, good.
For.
I think you'd be happy to, but I think you've emailed with Mary Tiemann, and you have Mary's contact information. And so she can actually give you show you how to log in. So you can actually log right into our CRM and post those jobs.
That'd be great. I will follow up with Mary.
Okay, terrific. Well, thanks everybody. Thanks so much for participating in our experienceIT conference. And with that, we will call it a day and call it a conference. So great to end with you all. Thank you very much. Have a great day.
Bye.
Bye.